Physician assistant education is very similar to medical student education. Physician assistants usually come in with more clinical experience than medical students do. Physician assistants learn the same kind of curriculum that medical students do, often right next to them. And I've found in the research that I've done that the physician assistant students have done just as well as medical students, in some cases better than some of our resident physicians. And their background and their quality of work has been really impressive.
I've had the pleasure of working with PAs in a few circumstances. I remember training with them as a medical student and enjoying that interaction.
We had our classes with the medical students. The same professors taught us. We were integrated with the medical school.
We took clinical medicine courses, we took anatomy, we took physiology.
Etiology and pathogenesis of disease, electrocardiography,
radiology,
psychiatry. OBGYN, surgery, internal medicine, pediatrics, ENT.
A lot of the basic sciences, and then we dive right into medicine, pharmacology, orthopedics, dermatology.
PAs and dermatologists working together can have a real benefit to dermatology for the simple reason that I can answer in one word: manpower.
I think the value of having a PA in a practice is really the ability to extend the practice's access to patients. Patient demand far exceeds the amount of providers in most areas of the country.
Cancer patients are interested in talking quickly about what's going on. They don't need to have everything discussed, but they need to get in quickly. And as one individual, I can only have so many new templates that are just mine. As a co-professional that I would consider the PA as my co-professional, if that person can be available to get them in and start that dialogue, I think we're going to really provide a better patient service.
PAs are pretty much able to do whatever the physician that's supervising them feels comfortable. So the scope of practice is dictated pretty much by their supervising physician. The physician assistants help us not only with our medical cases as far as evaluating and helping treat and follow up with them, but also assisting with some of our surgical cases.
I have two physician assistants that work in my practice, and I'm considering adding another to assist with Mohs closures. I could see a lot of opportunities for us to work together and increase our efficiency and expand our volume with a physician assistant directly working with me in surgery.
We see all types of skin conditions here in our office, everything from eczema to acne to warts. We see a wide range of patients. We see patients from newborns to patients that are 100 years old.
I see all range of conditions, from the uncommon pemphigus foliaceus all the way to the ordinary acne, pigmentary changes, rashes, psoriasis, the bread and butter of dermatology, just all of it. There isn't anything that we don't see.
I offer just about everything for cosmetic procedures, from injectable procedures to chemical peels to all sorts of different types of laser procedures, and I find it exciting that technology is always changing. Those patients are happy, they're excited, and I like to help them feel better about themselves.
There is not a limit to the types of conditions that I see, that I've been able to diagnose and treat, order laboratory testing for. A big part of my position is the surgery, actually, and doing those minor in-office procedures that would otherwise tie my supervising physician up.
The PAs I've interacted with, I found have been extremely well trained, broadly trained in not only patient care issues, but the ability to work with active clinicians, almost instantaneous when they start.
I hope and I think that patients should feel comfortable with seeing a physician assistant, knowing that we're educated very well in the medical school model, that they're able to see us a little quicker potentially than they would be to see the dermatologist, but also feel confident that they could contact their supervising physician so that the patient would feel comfortable that they're getting the absolute best care possible.
In our practice, we literally work side by side. We work as teams. We have our own independent schedules, but we're all in the same hallway and we all share the same lab. In my 20+ years of working with PAs in the dermatology office, I have found that for me individually, that's the best way to work with a PA, and I think the patients enjoy it.